Stuttering happens because a child is nervous. This is a really common myth, but no, nervousness doesn't cause stuttering.
Talking about stuttering will make it worse. The research shows that some children become aware of their stuttering even during the preschool years.
Stuttering in toddlers is normal.
Some children who begin stuttering will recover naturally, but we can't reliably predict which children will and which children won't.
Hi, I'm Amelia and I'm a speech therapist.
And I'm Lauren, also a speech therapist. And today we're talking about childhood stuttering, what it is, what causes it, and when families should seek help.
There's a lot of confusion around stuttering, especially in preschool children.
So we're going to debunk some common myths.
All right, myth one, stuttering just means repeating words. Well, repeating words can be one part of stuttering, but stuttering is broader than just repetition.
Stuttering happens when the flow of speech is interrupted. A child usually knows what they want to say, but they may experience moments where their speech gets stuck or disrupted.
Yeah, so the most common feature we hear in young children is part word repetitions, like ball or baby.
Children may also repeat whole words like can I have it, stretch sounds out, which we call prolongations like sun, or have blocks where they try to say a word but no sound comes out for a moment.
Yeah, so parents might notice other signs too, such as facial tension, extra effort, or a child appearing stuck while trying to get their words out. Those are all things we pay attention to. Myth number two, stuttering happens because a child is nervous. This is a really common myth, but no, nervousness doesn't cause stuttering.
We don't think there's a single cause of stuttering. Research suggests it's a neurodevelopmental condition with a strong brain and genetic basis.
So things like language development, temperament, and everyday communication demands can influence when stuttering appears or how much it varies from day to day.
So while you might notice a child stuttering more when they're excited, tired, rushed, or trying to tell you a long story, those situations don't cause stuttering. They can simply influence how much it shows up.
Yeah, exactly. So it's also important to remember that stuttering isn't caused by bad parenting, anxiety, shyness, or a child copying someone else who stutters.
Exactly. It's no one's fault, and understanding that can be a huge relief for families.
Myth number three, stuttering in toddlers is normal.
This one needs a careful answer.
Yeah, so stuttering commonly begins during the preschool years. A large Australian study following more than 1,600 children found that around 1 in 12 children had started stuttering by 3 years of age.
At this age, children are also going through rapid language development, so some speech disfluency is common. Children are learning new words, longer sentences, and more complex ideas, which can sometimes lead to repetitions, pauses, or restarts.
The tricky part is that typical developmental disfluency and early stuttering can sometimes sound similar. So especially when stuttering first begins, speech pathologists look at the overall pattern, such as the types of disfluencies, how often they occur, whether there is tension or effort, and how the child's communication is changing over time.
Some children who begin stuttering will recover naturally, but we can't reliably predict which children will and which children won't.
Yeah, so that's why an assessment can be helpful. It allows a speech pathologist to understand the child's individual pattern and decide whether, reassurance, close monitoring, or early intervention is the most appropriate approach.
So the message is, stuttering can be common in the preschool years, but it's still worth understanding what's happening.
All right, myth number four. If we wait, the child will probably just grow out of it. Well, some children do naturally recover from stuttering.
But the challenge is that we can't reliably predict which children will recover and which children will continue to stutter.
Yeah, so that's why early assessment is important. It allows a speech pathologist to decide on the best approach for that individual child.
For some children, close monitoring may be appropriate. This is not simply waiting. It means regularly reviewing how the stuttering is changing over time, including things like the frequency and types of stuttering, whether there's increasing tension or effort, whether the child is becoming frustrated or avoiding speaking, and whether the communication, confidence, or participation is being affected.
Yeah, exactly. So for other children, early evidence-based treatment may be recommended. So particularly if the stuttering is persistent, increasing, or having an impact on the child's communication.
Yeah, the goal is to provide the right support at the right time, whether that is monitoring or treatment. All right, myth number 5, talking about stuttering will make it worse.
It's true. Parents often do worry that talking about stuttering will make their child more aware of it or cause it to get worse.
But research shows that some children become aware of their stuttering even during the preschool years, so avoiding the topic completely does not necessarily prevent that awareness at all.
Yeah, exactly. What matters most is creating a supportive communication environment for your child. So making sure that your child feels comfortable, sharing their ideas, and knowing that they're being listened to.
Stuttering can change from day to day depending on the situation. A child might stutter more when they're excited, rushed, or have lots to say.
Yeah, but these moments don't cause stuttering. Talking about stuttering can actually be a positive experience when it is done in a supportive, age-appropriate way and matched to your individual child.
If your child notices they're stuttering or talks about it, you can respond in a simple and positive way. For example, you might say, "Sometimes words get a little stuck. That's okay. I'm listening," or "You have lots to say. Take your time. I'm here."
Yeah. The goal is not to make stuttering a problem or something that a child needs to hide. It is about helping children feel comfortable communicating and knowing that they are supported.
Yeah, that means giving children time to finish their thoughts, maintaining natural eye contact, and responding to the message that they're sharing, not just the way that they're saying it.
Yeah.
Okay, number 6. Early intervention means we're making a big deal out of it.
Early intervention doesn't mean panic.
It means we're being thoughtful.
Yeah, stuttering can affect more than speech. For some children, it can affect confidence, participation, and even a willingness to talk.
And we know children can become aware of communication difficulties earlier than adults sometimes realize.
Yeah, so early support is not about labeling a child, it's about giving the child and the family the right tools at the right time.
All right, myth number 7. There's nothing we can do about preschool stuttering. This is another common misconception. Some families are told to simply wait and see, but there are evidence-based treatments available for preschool children who stutter.
Yeah, that's right. The Lidcombe program is the most widely researched treatment for preschool children who stutter, and it has the strongest evidence base.
Yeah. The Lidcombe program involves coaching parents to provide specific verbal feedback about speech. This includes acknowledging fluent speech as well as moments of stuttering, using techniques that are carefully tailored to each child.
Yeah, that's right. Parents work closely with a speech pathologist who guides how and when verbal feedback is used and also monitors the child's progress over time.
Other evidence-based approaches include the Westmead program, which uses syllable times speech, and Freestart, which considers the balance between a child's communication capacities and the demands placed on them.
Yeah, the best approach really just depends on the individual child and their family and their individual communication needs. So a speech pathologist can help determine the best approach for your child. Right, last one.
Oh, myth number 8. Stuttering treatment will cure my child's stuttering.
Many families understandably hope that treatment will make their child's stuttering disappear completely.
And look, the good news is that some children do recover from stuttering either naturally or with the support of treatment. Evidence-based treatments can be very effective, especially when provided during the preschool years.
Yeah, that's right. Look, but every child's pathway is different, so some children may experience a significant reduction in stuttering, while other children may achieve periods of very fluent speech, and some may continue to stutter, but they will become confident and comfortable communicators.
We also know that we cannot reliably predict at the beginning which children will recover and which children will continue to stutter.
Yeah, that's why the goal of therapy is not only about reducing stuttering, it's also about supporting positive communication experiences, confidence, and participation.
A speech pathologist can help families understand the options and choose the approach that best fits their child.
Yeah, that's right. So to wrap up, stuttering is a common part of many children's early communication journey, and it is not caused by anything a child or a family has done.
Yeah, every child's stuttering journey is different. If you have questions or concerns, a speech pathologist can help you understand what's happening and support your child to communicate with confidence.